Lachine wasn't a big hot spot in Montreal. We have a lot of residences in this area. We have a lot of apartment blocks, and it was one of the hot spots on the island. So we did have a lot of cases quite early in the first wave.
Très rapidement, au début de la pandémie, le CUSM a considéré le site de Lachine comme étant un site froid. On avait créé un CCMU local ici à l'interne avec l'ensemble des gestionnaires et on s'est donné l'objectif de protéger les patients, les proches aidants, mais également de protéger notre personnel. Le défi majeur durant la pandémie était de transmettre l'information à toutes nos équipes cliniques alors qu'on se retrouvait avec une pandémie tout à fait non connue et avec des directives tant à l'interne du CUSM que du ministère qui changeaient régulièrement. Le CUSM nous a permis d'avoir accès rapidement à des experts en prévention et contrôle des infections. Dès qu'on vivait une problématique, que c'était en approvisionnement d'épis ou peu importe c'était quoi, on avait un accès extrêmement rapide à la haute direction et on avait une réponse immédiate.
So there were lots of challenges at Lachine Hospital because it's a very old building. So the building was built in about the 40s. So our physical installations were challenging because the space didn't have the same ventilation that we have currently in new buildings. The layout of our emergency room is very tight and our stretchers are very close to each other. And we don't have individual rooms for patients. So we knew very quickly that we had to provide confidence in the community in Lachine in our installations, and we worked to set up a completely different system in terms of triaging our patients and also build installations outside. So we knew that the space we were working with was too small, so we built tents outside the hospital. It was a huge challenge for our biomedical engineers, our installations teams, our physicians, our nurses, our RTs, our radiology technicians. Everybody had to now practice working in these tents outside. So because it was a huge change in practice and a huge change in work for all the healthcare team, we had to do what we call our mock codes or mock resuscitations. There was a lot of anxiety at the beginning, but everybody would make sure each other was doing things safely. And, it really warms my heart to kind of know that when I was ungowning or gowning, that my teams would kind of check and I could trust my team. So we were lucky to have, a really close community of healthcare workers at Lachine who supported each other regardless of what their job was, just to make sure that we were doing things safely for us and for the patients. We had a particular challenge at the Pavillon Camille-Lefebvre. One of the challenges was that we have patients who are on ventilators. We were very concerned about their safety. So from the beginning, we decided that we would not allow visitors as a first step, and we really focused on training the staff on infection control techniques. We also isolated the building from the rest of the hospital. We closed off accesses. Normally there's multiple things that transfer between the pavilion and the Lachine Hospital because they have corridors that connect them. So we really isolated it. There was one point of entry.
Un gros défi était le personnel qui se retrouvait tant en courte durée qu'en longue durée. On a instauré un système où les gens devaient passer à un filtrage ou devaient avoir des masques. Et dès le départ, on a ségrégué le personnel. Donc, on a divisé vraiment notre personnel en courte durée et en longue durée. On a également mis en place, dès le départ, une augmentation de personnel au niveau de l'entretien ménager sur les unités de soins afin de permettre la désinfection de toute l'unité complète. Donc, c'était vraiment un ajout.
Our teams were amazing in their flexibility and their ability to be, understanding of the situation. We benefit from being part of the MUHC community. And I think in the future, I see that relationship growing. In the pandemic, we had physicians from downtown come help us here. For example, we had anesthesiologists that came to help us who don't normally work here. So I hope that in the future, there's more collaboration between the sites.
Une des grandes leçons tirées au niveau de la pandémie, c'est que ça nous prend des chambres individuelles. Le projet de modernisation, le ministre nous a annoncé un 200 millions qui va faire en sorte que l'hôpital va se rajeunir. Donc, c'est un pavillon complet et on va se retrouver avec vraiment de la fine pointe, avec des chambres individuelles totalement parfaits pour la prévention et le contrôle des infections. Beaucoup de demandes ont été faites au ministère qui ont été acceptées afin d'ajuster en fonction de la pandémie qu'on a vécue et des nouvelles normes qu'on se doit de respecter. Alors, c'est juste arrivé au bon moment pour ajuster nos plans avec les architectes. Alors, on est très contents.